Helicobacter pylori, previously known as Campylobacter pylori, is a gram-negative, flagellated helicobacterium that colonizes the human stomach, often leading to gastrointestinal disorders such as peptic ulcers and, in some cases, gastric cancer. It is estimated that nearly half of the world's population carries H. pylori, though not all individuals experience symptoms. Early and accurate detection of H. pylori is crucial for preventing complications, and non-invasive testing methods, particularly stool antigen tests, offer an effective and patient-friendly diagnostic approach. H. pylori infection is relatively common in the United States, although its prevalence has declined over the past few decades due to improved sanitation and widespread antibiotic use. Current estimates suggest that approximately 30 to 40% of the U.S. population is infected with H. pylori, with higher rates observed among older adults, lower socioeconomic groups, and certain ethnic minorities. Infection is often acquired in childhood and persists if left untreated. The prevalence varies geographically, with higher rates seen in populations with limited access to health care. H. pylori infection rates are notably higher in certain indigenous populations in Alaska. Studies have shown that up to 75% of Alaska Native adults and children are infected with H. pylori, significantly exceeding the national average. The high prevalence has been linked to factors such as crowded living conditions, limited access to clean water, and challenges in healthcare accessibility. Furthermore, Alaska Native populations experience higher rates of H. pylori-related complications, including gastric cancer, making early detection and treatment particularly critical in these communities. The discovery of H. pylori is one of the most remarkable stories in modern medicine. In the early 1980s, Australian physician Barry Marshall, along with pathologist Robin Warren, identified H. pylori as the primary cause of peptic ulcers. At the time, the prevailing belief was that ulcers were caused by stress and lifestyle factors. To prove his hypothesis, Marshall took the extraordinary step of drinking a broth containing H. pylori, subsequently developing gastritis, which he then successfully treated with antibiotics. His groundbreaking work overturned decades of medical doctrine and ultimately earned him and Warren the Nobel Prize in Physiology or Medicine in 2005. Gastrointestinal diseases, including those caused by H. pylori, contribute significantly to healthcare costs in the United States. In 2015, total healthcare expenditures for gastrointestinal diseases were estimated at over $135 billion, making them one of the most costly categories of healthcare spending. Conditions associated with H. pylori, such as peptic ulcer disease and gastric cancer, account for a substantial portion of these costs, highlighting the economic burden of undiagnosed and untreated infections. Early and accurate diagnosis using non-invasive methods can help reduce long-term healthcare costs by enabling timely treatment and preventing complications. Traditionally, invasive methods such as endoscopy with biopsy have been used to diagnose H. pylori infections. While highly accurate, these procedures can be costly, uncomfortable, and carry certain risks. Non-invasive testing options, including stool antigen tests, urea breath tests, and serological tests, provide an easier alternative with significant benefits. Among non-invasive testing options, stool antigen tests are particularly advantageous due to their reliability, affordability, and practicality. Unlike serological tests, which can remain positive even after successful treatment, stool tests detect active infections, ensuring accurate diagnosis. Stool antigen tests are recommended for confirming eradication of H. pylori following treatment, as they effectively identify ongoing infections. Collecting a stool sample is a simple process that can be done at home, making it more comfortable for patients than breath tests, which require specialized equipment. Stool antigen tests have been shown to be particularly useful for diagnosing H. pylori in children who may have difficulty complying with breath tests. Given the prevalence of H. pylori infections and their potential health consequences, early and accurate diagnosis is essential. This is why Hardy Diagnostics is proud to now offer an easy-to-use rapid H. pylori antigen test called QwikID H. pylori Rapid Antigen Test. This is a one-of-its-kind FDA-cleared assay for the rapid detection of H. pylori antigen in human stool specimens. QwikID H. pylori Rapid Antigen Test utilizes a pair of H. pylori-specific monoclonal antibodies to detect the presence of fecal H. pylori antigens indicated by a pink-red color line. To perform the test, a diluted stool sample, which is first prepared in a sample preparation tube, is added to the test cassette. If the sample contains H. pylori antigen, a pink-red test line next to the letter T, along with a blue control line next to the letter C, will be visible in the rectangle result window. If H. pylori antigen is not present or is present at very low levels in the stool sample, only a blue control line will be visible. This product is room temperature stable. Each kit contains 20 test cassettes, 20 sample preparation tubes, and a positive control reagent. Within just 10 minutes, you will have results. For more information regarding this test or to order your free sample, please visit hardydiagnostics.com.
Subscribe to our YouTube channel for more free tutorials and product videos. Remember to turn on the notification bell to be reminded of new videos as they are released. Hardy Diagnostics is 100% employee-owned and has been serving microbiologists for over 45 years. To learn more about Hardy Diagnostics and the products we offer, visit us at hardydiagnostics.com.